So, welcome everybody. I'm very honored and humbled to be at DLD. It's actually my first time and immediately on stage. And I had a bit of a hard time finding which use cases should I present first because I went to medical school. I kind of like, I would say almost dropped out of medical school. I took the way out of the hospital because I realized I don't want to treat only 36 patients a day and have 3 night shifts. And it felt like it's not the right environment and probably not the right employer for me. So I went into tech back in the day when it wasn't called AI and we just had statistical models. And I founded my own companies. Now I'm a strategic advisor to 10 startups from Israel coming to Europe or European startups doing disruptive medicine. As long as the end use case and the patient is a disease that I like, I will most likely help you. So besides all the startups and some of the things I'll be presenting here today, I work at Parloa, like Mark already said. It is the #1 AI voice agentic company in the world right now. So later I will get it more into Parloa, but that's kind of my background. I manufactured in Vancouver, and I've been 7 years in Germany, and most of my projects are therefore also very global projects that I hope I can inspire you guys today. So I'm going to take you guys on a little journey because when I was 12, I said, or actually I cut open with my mom's kitchen knife rats because I really wanted to see what animals look like from the inside. And my parents knew, okay, she's either going to be a doctor, we hope she's going to be a doctor. And then I realized in medicine that so many discoveries that we had are kind of like by accident, like finding penicillin. We didn't really know kind of what we're doing. We're just like diving into a patient almost blindly, not really understanding mechanism of disease. And that's exactly why I wanted to go into tech, because I got a little bit annoyed with the way that we're practicing medicine. I wanted to do something like precision. That was always my vision, to say, like, I want to see the smallest molecules. I want to understand where disease really starts. And I also want to see how can we support doctors with other technologies, for example, robotics, or just facilitating with the things that we in the daily care in the hospital don't really have time for. All right, so one of the use cases I'm going to present now is, and first of all, for you guys to kind of have an overview of what my ecosystem looks like. So for me, everything, because I did medicine and I'm an engineer in AI, so AI and data intelligence is always in the center. And I'm going to take you guys on this journey with nanorobotics, agentic AI, space medicine, generative medicine, and clinical trials in only 15 minutes. So guys, please stay with me. So the first case I'm going to present is what makes voice so iconic and so important in healthcare? Is it the tone? Is it the accent? We have turned sound into connections without any limitation. Voice gives us strength, personality. It makes us feel heard as a patient. Technology is a medium. Voice is the humanity amplified. And this is exactly the reason why I wanted to join Parloa. It is a Berlin-born startup. We're now a unicorn with offices in New York and London and Munich. Now also in Silicon Valley, so in San Francisco we opened, and we're growing really strong also now in the healthcare industry. Besides, of course, the chatbots that we do, and for example, handling reminders or triage of patients, what I think is the most fascinating is connecting with your own personalized agent to every individual patient. Imagine you're a cancer patient, and every time you get a phone call as a reminder, please take your medication, and this agentic AI is saying your name, speaks your language, and has your accent. Because also Parloa is in 150 different languages, different dialects, which we have a lot of fun with, because for me as a Canadian, I don't understand Schwäbisch or Bavarian, so we play around with our bots to make sure that our patients are really understood. And one of the cases that we have right now in a hospital in north of Germany, and it also kind of ties into my mother got cancer. She lives in Düsseldorf, and no doctor ever after her therapy said you have other options. And I got slightly annoyed that, like, why isn't she being offered? She's super young. Why is there no clinical trials for her? Why is the oncologist not giving her any other alternative? So what we rolled out now with Parloa is 2 different cases. The one is the agent matches the perfect candidate of the cancer patient to the perfect clinical trial. And the other one, which I think is really super cool, I think for everybody also here, is that the agent will call you in your language to make sure that you're feeling safe, secure, that you trust your doctor who's treating you in this clinical trial, and just to make sure you also don't drop out of the clinical trial. Because I think, in my opinion, patient education is key to everything we do in healthcare. Now I'm gonna, because Parloa is something you have to experience, I'm gonna show you guys how the voice sounds like. Be aware we have a lot of premium voices. It's so human-like, you barely even hear the difference if it's a human or an agent. But in this case, because it's a regulated environment, a hospital, it sounds a little bit more like a robot. So here we go.
Do you have 3 minutes right now to go through these questions with me? Yeah, sure, I got time. Great. I will ask you 5 questions about symptoms you may have experienced. For each question, please tell me how frequently you have had that symptom. For example, never, rarely, sometimes, often, or always. Understood? Or do you have any questions about that? Nope, all clear. All right, first question. How frequently have you experienced nausea? Nausea I have had always. Understood, always. Thank you. How frequently have you had to vomit? Vomit, thank God I never had to do. Got it. Never. How frequently have you had diarrhea? Also never. Got it. I have noted never. How frequently have you had abdominal pain? Sometimes, actually. Understood. I have noted sometimes. Great. And now for the final question. How frequently have you experienced chills? Chills I've had sometimes. Thank you. I have noted sometimes. Thank you very much. That's everything. Thanks for taking the time. I will forward your answers as a summary, and you will receive a follow-up email shortly. I wish you a lovely rest of your day. Goodbye.
And this is the precise case that we have right now to make sure that all of this information then goes in the hospital information system. And if there's a red flag somewhere coming up, that the oncologist or can then take care of that particular patient. So, and now I'm going to take you guys in the freaky future. So there are some cases here. So some of it is my own startups. Some of the startups I'm working with, like either with their medicine or helping them promote the companies. So it's like a big like different fields that I'm presenting. So in Abu Dhabi, I met this guy at a conference who is from Haifa University, and he didn't know what to do with his technology. So he developed these tiny, tiny nanorobots that you inject almost like a stent into your cardiovascular system. And the nanorobots, based on vision AI, can then find the more acidic and the tumorous cells. Perfect case for leukemia. So cancer cells have a pH of 0.2. Normal cells maybe around like 7.2, 7.4. So it only finds the acidic cells and then can eliminate them. Another case of such nanotechnology that's being implemented already is for more the solid tumors, and then cutting off, as you see, the tiny little particles going there, cutting off the bloodstream to certain solid tumors. That's another one of those innovations I hope we can bring to Germany. And then the latest projects that I'm working on are actually space medicine. So anybody who's interested in this, please come to me. The space system is quite, yeah, we're super easy going to work with everybody. And it seems like everybody in space and medicine also knows each other. And what we're doing there, so it's kind of in 2 parts. I work with a company called Atmos Space Cargo and another one called exobiosphere. So we've really entered the orbit. And why? Because in space, proteins, cells, drugs, and crystals behave completely differently. It's a very powerful environment to do medical experimentation. And yeah, and that's exactly why we're now exploring with big pharma companies what use cases could make sense there. So like I said, the ecosystem of space is super exciting. We're doing things from radiation, from sending 3D printed organs up into space. So, I mean, the ideas are endless. You just need to come and talk to the right people. And one of those people is the guy here in the picture, Jeffrey. I met him at my last panel discussion where he said, like, Anita, you really need to see my rocket. He kind of whispered it in my ear. And I got a little bit creeped out. I'm like, oh gosh, I live in Berlin. The last time somebody wanted to show me his rocket, it didn't turn out so well. So I gave Jeffrey a chance, and his rocket was actually standing outside. And you can kind of see you don't see how big it is, but it's kind of like twice this room. And you can have 3 different experiments in there with protein crystallization or whatever. But that's one of those German companies who's already sending experiments into space. So stem cell growth, everything around longevity, because yesterday at the dinner, so many people were talking to me about longevity. Please explore the space industry because it could be very, very relevant for you. Then to show you guys what this can look like, so the rockets then go into space. It opens up. I always tell my parents, I'm now sending donuts into space. Thank you for the 16 years of university degree. But this is what it looks like then. It separates, and then you have this capsule. So the one that looks kind of like a donut is the capsule that then can land back onto the Earth. So this is the kind of experiments we do. So it's never human beings up there. It's only robotics and all of these little boxes that you see now in the video. So they look kind of like a shoebox, and then in one shoebox you can do one specific experiment, and then you stack 3 of them on top and send them up. Cool. Then the last topic for today, which I'm really, really excited about, so I hope there are some surgeons in the room, is Matriself. It's an Israeli company. They have done something that is, for me, coming from the neurotech space, completely fascinating. We all might know somebody who's had an accident and then the spinal column got completely disconnected and end up in a wheelchair. If you have early trauma, what they have actually done, they take their own stem cells, produce a personalized hydrogel, inject it back into your spinal column, and they've actually seen that rats can walk again and now slowly starting to test this on human beings in Tel Aviv. So just to show you, so that's the control group. Here you see the hemiparesis on the bottom. So the one leg is not functioning correctly. And only after 2 months of having this hydrogel being injected in the rats, you will see in the next one that he is working perfectly again. So those are some of the topics that I'm completely inspired with, and I hope you guys are as well. And I'm looking forward to connecting with you guys all after this keynote.